أعزائي طلاب المرحلة الثالثة كلية الطب جامعة كربلاء، السلام عليكم ورحمة الله وبركاته. أنا دكتور علي منصور. اليوم راح نحكي عن محاضرة البريست كانسر جينيتكس. راح نحكي عن genetic basis of breast cancer. نتناول الأوبجكتيفز الآتية: sporadic versus familial breast cancer. راح نتكلم عن hereditary breast cancer بالخصوص. نحكي على الجينيتك تيستينج أو جينيتك كونسلينج، الانديكيشنز، البنفيت، الليميتيشن. وأيضا راح نتكلم بهذا الخصوص عن بالتحديد عن البريست كانسر جين BRCA 1 and 2 اللي هي most common. أيضا راح نتناول another genes اللي هي involved in breast cancer اللي هي الهيرتونيو والفاسكولار endothelial growth factor. As we know, all cancer types, whether familial or inherited or sporadic, involve a change or a mutation in the gene. This change or mutation occurs usually and it normally corrected by DNA repair mechanism. And when this mechanism is damaged, this leads to the accumulation of the mutation, and if this exceeds a threshold effect, a certain threshold effect, this will lead to cancer development. So, all cancers arise from mutation, but not all cancers are inherited. In fact, speaking about breast cancer, most cases are sporadic. About 80% of breast cancer cases are sporadic. That's to say, there's a mutation acquired during the lifespan or lifetime of the person. And this mutation is due to unknown cause, but there is multifactorial effect of interaction of age, environment, certain lifestyle like obesity and alcohol. Also, there is chance and other unknown factors. Sporadic breast cancer generally has a later onset. Well, this figure shows the frequency distribution of breast cancer, whether it is inherited or sporadic. In fact, we have most cases, 80% are sporadic cases, and about 10 to 15% occur within families but not inherited, while only 5 to 10% of breast cancer are inherited. So we will talk about occurring of cancer within the families. In fact, there is about 20% of women with breast cancer have positive family histories, and this group could be divided into two subgroups, including familial and inherited. 10 to 15% of these cases are said to be familial, and this is due to the occurrence of the breast cancer within the family, but it is not inherited. That's to say, there is no known gene that causes this occurrence. Instead, it is due to another environmental factor like sharing a common food habit or similar other lifestyle. Also, it may be explained by undiscovered gene mutation or by chance. Generally, this group cannot be eligible for genetic testing because, as we say, the familial breast cancer has no known gene that causes it. On the other hand, the other group, which is a smaller group, subgroup, 5 to 10% of familial breast cancer are said to be inherited, and this is caused by a known gene mutation which cause a higher risk of breast cancer development. About two-thirds of these genes are BRCA1 and BRCA2, and this BRCA is abbreviation of breast cancer, as you know. And it leads to a variety of cancer syndrome, including ovarian cancer also. This group is eligible for genetic testing and genetic counseling because there is a known gene. Now, as a summary, speaking about people with positive breast cancer gene mutation, there are certain features. First, they have higher risk of developing breast cancer. This is because they share the genetic risk and the environmental risk with the other population. Also, there is a younger age of onset of the cancer, about less than 50 years of age. Also, they will have multiple primary cancer other than breast cancer, which is usually ovarian cancer. However, the hereditary cancer is less common in the general population than the sporadic breast cancer, as we said. From the genetic point of view, BRCA genes are normally present in our cells. BRCA1 present on chromosome 17 and BRCA2 present on chromosome 13, and they are transmitted by or inherited by autosomal dominant transmission. But only when there is mutations in these genes, this will lead to the risk of development of the breast and ovarian cancer. So we are speaking about mutations in BRCA genes, and more than 2,600 mutations known in these genes lead to this risk. The carrier frequency of these mutations in the BRCA1 and 2 genes is about 1 to 500 to 1 to 1,000 in the general population, but it is tenfold more in the Jewish population. Just to remember, by definition, the autosomal dominant inheritance means that a single allele is enough to show the phenotypic effect of that gene. This figure shows the Punnett square to explain the autosomal dominant inheritance of BRCA mutant gene. This is an example when a healthy man marry a carrier woman with a single allele of the mutant BRCA gene, and the figure shows their sibling who have the 50% carriage of the gene in both daughters and sons. So we have 50% of their daughters carrying the genetic mutant BRCA gene, while the other 50% of daughters show no genetic risk, only the populational environmental risk. And this is true for the boys also. So what is the consequence of having a BRCA gene mutation? This table shows the estimated cancer risk of breast and ovary by age 70 regarding the carriage of BRCA gene. For the breast cancer, a female carrying BRCA1 or 2 gene will have increased risk from 11% up to 50 to 85%. While for the ovarian cancer, BRCA1 gene increased the risk from 1 to 2% up to 40 to 60%, while BRCA2 gene mutation carriage increased the ovarian cancer up to 10 to 20 only. For the male, the carriage of BRCA2 gene mutation increased the risk of breast cancer up to 6%. As you know, genetic counseling is a procedure involving advice and investigation and other procedures performed to certain people with genetic disorders. Genetic testing is part of the genetic counseling. And now, what is the indications of genetic testing in case of BRCA genes? There is different situations that necessitate the genetic testing for BRCA gene mutation. The first condition is when there are multiple cases of breast or ovarian cancer in the family tree, especially if these multiple cases include closely related relatives, or they occur in more than one generation of the family, or if they are diagnosed before age 50. So the first condition is when there is multiple cases of breast and ovarian cancer in the family history tree. The second indication is when there is one family member with breast cancer diagnosed before 35. if a patient have family member with breast cancer diagnosed before age 35, this is an indication for genetic testing for BRCA gene. The third is a family member with both breast and ovarian cancer. Again, it is another indication for genetic BRCA gene testing. And lastly, the Ashkenazi Jewish heritage, because as you know, there is a very high, about tenfold risk of having the genetic defects. So they are indicated for genetic counseling or testing for BRCA gene mutations. Now, the fifth indication for BRCA gene testing is when a woman has a family member with primary cancer in both breasts, especially before age 50, or she has a family member with ovarian cancer, or a woman has a male family member with breast cancer, and lastly, if she has a family member with identified BRCA1 or BRCA2 mutation. So all of these are indication for BRCA gene testing for that person. Now, what is the benefit of doing genetic testing for BRCA gene mutations? As you know, if we have a patient with positive BRCA gene mutation, we will have some advice or counseling to avoid or to decrease the chance or the risk of developing a breast cancer in the future. First of all, we should reassure the patient, because as you know, presence of a mutation not necessitate that there is an inevitable cancer or or to indicate the presence of cancer. The second important point is lifestyle advice, and this include reduction of dietary fat and avoiding obesity and weight control, reduction of alcohol consumption, and regular exercise performance. These are all advices to reduce the chance of development of breast cancer in the future. There are certain points to keep in mind regarding breast cancer. Despite focusing on the genetic causes of the breast cancer, we have most women will not develop breast cancer, as we said before, and of these who develop, most will not have a known family history. And as you know, the most common risk factor and the greatest risk factor is increasing age. The other point is that most women with family history of breast cancer do not fall into a high risk category. They may be classified as mild or moderate risk, and they do not develop breast cancer. Most of them do not develop breast cancer, and most of them, of those with family history, are not eligible for genetic testing, except the condition and indication we mentioned before. The last important point is that all women should be breast aware, whether they are positive for genetic testing or negative. All women should be breast aware. This means that they should contact their healthcare provider if any lump or breast changes are noted on self-examination. Now, regarding other genes of breast cancer, there are some other genes other than BRCA gene. The first gene is HER2/neu gene, and this gene codes for HER2/neu receptor. This receptor is responsible for breast cell growth, and it is normally present in the breast cell. And the HER2/neu gene, is tested by fluorescent in situ hybridization, while the HER2/neu receptor, which is the gene product, tested by immunohistochemistry test. And normally, breast cells have about 20,000 HER2/neu receptors per cell, while some breast cell and breast carcinoma cell contain up to 2 million HER2 receptors per cell. In fact, not all breast cancer have this gene. but only 20 to 25% of the breast cancer express HER2 receptor. But the ductal carcinoma in situ have more percentage of expression of HER2, about up to 60 to 70% of the ductal carcinoma in situ cells express HER2 gene or HER2 receptors. Overexpression of HER2 receptor in some breast tumors have therapeutic implications. We have a monoclonal antibody, which is an immunotherapeutic agent for some breast cancers. It is called Herceptine, or scientifically it's called trastuzumab. This monoclonal antibody may be curative for some cases of breast cancer, and the response is only in case of HER2 positive breast cancers. Now this diagram explains the mechanism of action of Herceptine. As we explained before, HER2 gene code for HER2 receptor in some breast cancer cell, and this HER2 receptor is responsible for the growth and development and invasion of the tumor. The drug Herceptine is a monoclonal antibody specific for binding with the HER2 receptor, so it will act as a ligand for HER2 receptor, and thus closing this receptor and securing its effect by growth development, and this lead to regression of the tumor and lead to the reduction of the aggressiveness of the tumor and invasiveness of the tumor also. Now another gene is vascular endothelial growth factor gene, which codes for vascular endothelial growth factor, which is an angiogenic factor. This was developed or described during 1980s to be an endothelial cell proliferative factor and a vascular permeability increasing agent. And also during 1990, it was shown to be an anti-apoptotic agent. This means that lead to overgrowth of the cells and decrease the mitotic divisions. This factor is normally expressed by blood vessel of certain tissues, but it is overexpressed in some tumors like those of the eye, colon, and some breast tumors. Now this figure shows how vascular endothelial growth factor causes angiogenesis or blood vessel formation in the tumor. The first step is when tumor secrete or release this factor, which is vascular endothelial growth factor. There are several types from A to E, and these vascular endothelial growth factors bound to specific receptor when they around the blood vessel, and these receptors are called vascular endothelial growth factor receptor 1, 2, and 3. The result of this binding is signal transduction from the cell membrane to the nucleus, and this will lead to gene expression and formation of certain products, which lead to endothelial cell proliferation and migration and new capillary formation, and the net result will be neovascularization and enhancement of tumor growth. Again, there is therapeutic implication of vascular endothelial growth factor, and this is represented by the drug Avastin, which is called bevacizumab, and this drug was a monoclonal antibody discovered during 1990s, and this antagonized the effect of vascular endothelial growth factor, leading to regression of the tumor. This drug went through a phase 1 trial during this period to treat some cancers, and it was truly approved as a therapeutic agent since 2004 for some types of cancers which express this vascular endothelial growth factors, including some eye tumor and colon tumor, and also some metastatic breast cancer. Thank you very much for listening and see you soon.